Right, welcome to our health and wellbeing show here on Uxbridge FM. And it's a welcome back to Michele Stevens, who runs Wellness by Michele. Hi, Michele.
Hi, Steve. How are you?
Good, yes, not bad.
Excellent.
And today we're hopefully going to be clearing up some confusion between complementary and alternative or holistic therapies.
Yeah, well, hopefully, yes.
There's a bit of confusion, isn't there?
Yes, the terms can be used together, and they're often saying complementary and alternative therapy or a holistic therapy. And actually, they can mean different things depending on where you are and who you are. So a doctor would say alternative is saying not using any Western medicines, you're refusing that treatment and you're just going to go purely on the alternative route and not take part in anything that the doctor prescribes.
Yeah.
Complementary is when it's used with and in conjunction alongside existing Western medicines. So, for example, the easiest way to explain that is in cancer therapy, you have your chemotherapy, radiotherapy route, and the complementary side to that is the use of massage and reflexology to help people relax and distress.
And there can be a crossover, can't there, as well?
Yes.
So give us some examples of complementary therapies then.
So complementary therapies, and that term is when it's used alongside conventional medical treatments prescribed by your GP, your doctor, your consultant, are things like aromatherapy, acupuncture, some types of herbal medicine, massage therapy, visualization, yoga, reflexology. There is no, it's not a defined list. It's whatever's used in conjunction to complement the existing treatment that you're going on. But by the same route, it can also then be considered alternative by some practitioners, some doctors, when it's used instead of the conventional medical treatment.
And do you think some GPs are coming round to the idea of complementary therapies?
Yes. Yes, I do. It's not everywhere, and there's not always that warm, welcoming feeling. I've approached different places, and some are like, "Oh, I really like it myself, but it's not something our practice will endorse or recommend or anything like that." So you respect people's decision, you respect the practice's decision, and I passionately believe that. Wellbeing is for everyone, and now wellbeing, there's no one magic bullet or one magic key that will hit at the need in every person in the same universal way. Everyone's a unique individual, and each treatment will be different from you. But I keep promoting the importance of taking time out for yourself to wellbeing, whether that you look at it as a complementary therapy, an alternative therapy, or holistically. My approach is holistically. I look at the whole person and not one body part.
So what complementary therapies do you provide at your treatment practice?
Reflexology, massage, colour therapy, my colour mirror system. I love using colours within my treatments. Yes, and just providing that relaxing time for people and giving them the time to talk about themselves.
Yeah.
What's brought you to see me today? What do you need from my services? How can I be of service to you? So listening to the whole person. So yes, it's essential that I understand if they're on any medication or had operations, because I provide a safe space, a safe treatment. But then it's about peeling back the layers of the onion to get to the origin, the root cause of whatever it is. And it could be something that happened in their childhood.
Yeah.
But it doesn't manifest itself or come out in the body until much later in life. So it's a mixture of hands-on therapy, but very much about listening to people, because the one thing I hear is when people go to doctors, and I've had it myself, you go to consultants, oh, it's your shoulder, oh, it's your knee, it's your back. Actually, no, we are a whole being. And we are connected, like that song is about your knee bones connected to your thigh bone, and there on and there is. We're not isolated parts.
So often you only get like 10 minutes, don't you, with a GP? It's not probably long enough to find out about someone's life history, is it? Whereas with you, you've got the time to talk through stuff.
Yeah, I mean, in that first treatment, it's not. So I'm causing havoc here. in that, it's moving. In that first treatment, we can't get to everything in one go, but over the period of time, we will address it, and people will remember things and talk about things and feel freer in themselves to talk about what's causing their issues or their problems, and they become part of my family. My clients become part of my family because they're important to me, and I think they're brilliant.
So sometimes, do you think the actual therapy, the reflexology or the massage or the colour therapy, is almost a side thing? It's the talking maybe sometimes that people are going to you for, or is it both together?
Both together. All of them together. As I say to my clients, they come to see me for that hour and a half, however long it is that they want to book me for. And in that time, I will use whatever tools in my virtual toolkit. If you can imagine, like the electrician's toolkit, it will be, it's massage today, or it's reflexology, or it's the use of my colour mirrors, or combination of all three, depending on what that person in front of me needs at that time.
So massage therapy I get, reflexology I kind of understand, but I don't know much about colour therapy.
My colour mirrors.
Colour mirrors.
The colour mirror system. It's just playing with colours. It's having fun. And using colours in ways to help you enhance positivity, release any negativity, any blockages, embracing the future. Our bodies understand colours on such an elemental area, and colours in the use of medicine, in the use of holistic practices, alternative, complementary, westernized medicine, has been for eons and eons, since the beginning of the time. Think about chakras. The colours in the chakras. What do those chakras mean to you? But there is becoming more and more scientific evidence about the chakras and how being in balance, which is what I do, is about bringing balance to people, is if something is off kilter, it's affecting everything else. And I love it. I love the work. I love playing with my colours and introducing my clients to it. And it's about what makes sense to you. So, for example, red, the colour red, what does that mean to you?
Well, red to me means sort of anger, I suppose, and
does it?
Stress.
Really?
Whereas I think of blue as being more calming seas and skies, maybe.
And what colours would you say you're more drawn to?
Well, like an orange and a yellow, a nice sunset.
Yeah, you've just listed literally the colours, most colours of the chakra. Yeah, but it's interesting because you say red, anger, stress. We're in February, it's Heart Month, it's Valentine's. What's the primary colour that's around at the moment?
Oh, I suppose, yeah. Yeah, interesting.
Yeah.
So red.
Red. You're a communicator.
Yeah.
Blue.
Okay.
For your throat. Your throat chakra, communication, expressing yourself.
Oh, right. I'm learning, you see. Okay.
But it's beautiful. But it's a gentle way of helping people embrace changes, let go of repeated patterns, and it's a gentle way that the body understands. It's gentle, and the smells of the essences are gorgeous. The use of the colours make you smile. You know why when we're in a situation. I can remember doing presentations in my previous lives, and you put on your power suit.
Yeah.
Your colours, your big block of colours, you know, to give you that boost that you needed. And now that I know it, you go to the cheerful colours when you want cheering up, or you wear the darker colours when you're feeling a bit, you know, it's amazing how we instinctively, without even thinking about it, will use colours to make us feel better.
Yeah.
And also there's days a bit like in the summer now, we all want to wear bright colours because we feel good.
Yeah.
And we want those bright colours in our life. But In the winter, I want bright colours. I wear my colours, and you just want. Oh, I feel like wearing red today, or I feel like wearing this today, and it gives you that spark.
I have to come for some colour therapy.
Yes, please do.
So obviously you've got experience working with cancer patients,
yes,
and using complementary therapy. Give us some examples then how that would work when someone's just had some radiotherapy or some chemo or other cancer treatments.
It actually starts from the very beginning, because when someone's had a diagnosis of cancer, it can be absolutely shocking on so many levels, and the body goes into shock, stress, anxiety. It impacts people and their families. It's not just the person that's diagnosed, it's the families as well. So my thing is supporting everyone. And with the use of complementary therapies within the actual cancer treatment itself, it helps to reduce nausea, keeps the stress levels down, and there's some studies out there at the moment to prove how effective reflexology is in the use when they're having combined, like chemotherapy. It helps. If you keep the cortisol levels down in the body, the chemotherapy can work it more effectively.
Oh, I see.
Also, with chemotherapy, it is a toxic. It's been used to eradicate the cancerous cells. But there's that fine balance about you don't want it in the body for too long. And there's some hospitals that while patients are undergoing chemotherapy, they're actually having reflexology treatment as well, to help the body to stay calm, to reduce that anxiety. It's also giving someone a pleasurable experience. Instead of associating the act of chemo as nausea-inducing pain, what's this going to do? It comes that they're going to get a treatment that's making them feel good. So on many levels, it's the Western medicine and the complementary medicine working together to actually heal that person.
Yeah.
So it's a hand-in-hand approach, and I love that approach. And to help people just relax and feel good, it does so much things on so many levels, and the fact that someone can actually look forward to having a treatment and being listened to, because you'll chat to your therapist, and it's a wonderful thing. And for me as a therapist, it's a privilege to help people regardless of whatever they're going through. It's an absolute privilege to be of service to people in whatever their needs are.
Some interesting experiences there. That's at Mount Vernon, is it? You help out there?
Hillingdon Hospital, the Macmillan Centre there, on the first floor. So and they're wonderful people there. Wonderful people, and it's lovely. And I've met some amazing people.
So how would you decide whether you wanted to use complementary or alternative treatments? Because I know sometimes the NHS, there are some conditions, aren't there, where the NHS does have lists and things that says, right, okay, things like osteopathy in chiropractic are good for lower back pains, for example, but there's not all conditions, are they, that are covered by complementary alternative treatments?
No, it's because it's very difficult, or hasn't been undertaken, shall we say, any studies by scientists. It's independent scientists. All the treatments that we have now have been backed up, as we would. You're taking drugs or whatever you want. They want the studies to show it works. It's effective. However, if something works for someone, don't dismiss it. It works. Let it go. And the judgment around, well, you shouldn't be having this, you shouldn't be having that, I don't agree with at all. To me, no judgment. Whatever makes someone feel good, whatever makes someone feel better in themselves, surely that's a good thing. So massage, reflexology, whatever, acupuncture, yoga, visualization, counselling is a therapy. But the thing is to know what you want to get out of it, both as a therapist and a patient. So for me, it's every time I see someone, it's what do you need from me today? Because your needs would be very different today than they were yesterday. We are. By tonight, and you're doing Hillingdon hour, you'll be totally different. Oh, yeah. I'll ask you how are you, and you'll be like, oh, yes. So it's how can I say it? Complementary and alternative medicines or treatments are based on principles and evidence-based that has not been recognised by the majority of independent scientists. And now I've just read that because it's important to say that's the terms.
Yeah.
For me, I know it works.
Yeah.
Any healthcare, the holistic practitioner that works. And half the battle is the person receiving the treatment. If you want the treatment, if you believe in the treatment, it's already working.
Now, the weird thing for me is that there's you can start yourself up as a alternative therapist and just say, hi, opening a shop or a business tomorrow, have no qualifications. That's a bit strange, isn't it? I mean, how do you find a qualified or experienced therapist? What should you look for in terms of, are there any industry governing bodies or, that kind of awards or whatever? Obviously, you're members of all kinds of bodies, aren't you?
Yeah, I'm a member of the Association of Reflexologists, which is an accredited body that high standards of training and the guidance they give, and they're a recognised body. They're promoting, I think, since 1984 about reflexologists, and anyone that's a member of the Association of Reflexologists can use the MAR, member of the Association of Reflexologists, and it's look for that as a standard of someone who is a member of an association. I'm also a member of the Complementary National Healthcare Council for reflexology registered, so you can check me up on both those places, and I'm on the list of registers. And that means that they know that I've been trained to a high level, that I adhere to certain standards and practices, that I do my training and refresher and have so many training points throughout the year.
Right.
My insurance and just all of that, so that that there's a standard. But it's not just our industries that anyone can set up in. Hairdressers, I do believe, you don't have to actually be qualified to set up as a hairdresser. And there's a lot of places and industries that you don't have to be a member of anyone or registered in any way. I choose to go down the registered route because I want to assure my clients that I have reached that certain level. When you're working on the body, I believe I have a duty of care as a practitioner to give my clients the very best.
Yeah.
And that includes my knowledge, my skills, my training, as well as my need, my want to help someone.
Yeah.
For anyone looking, check the professional bodies, check to see if they're registered, phone the person up that you want to go and see, regardless of whatever therapy it is, talk to that person. I don't accept bookings over the phone, by text. I talk to my clients.
Yeah.
I speak to them, we talk about what they want, because for me, the importance of me in my role is if I'm not the right therapist for you, I will refer you on to someone who is.
Oh, that's good, yeah.
So I very much, it's that level of care from day one.
Yeah, I mean, I suppose finding a plumber or finding a electrician, you go and look on Check a Trade or whatever.
It's word of mouth, isn't it?
You go and look on TripAdvisor.
Or you speak to your mate and you say, have you got a sparky you can refer me to, or a plumber or that. That's how I found my magical plumber. It's the same with the therapist. Ask around. You will be surprised by who is going and having what treatments.
Yeah.
And unless you ask, you don't know.
No. And I suppose there's all kinds of health fairs and things where you can easily, no stress, just walk up to the stall or the person and say, oh, I've got this problem. Could you help with that? That's an easy route in, isn't it?
Oh, absolutely. And it allows you to engage straight hand and you know that there's no pressure. And that's the thing I say to everyone. There's no pressure. Come talk to me. Talk to me. There is absolutely no pressure. And I'm doing an event with some wonderful colleagues of mine, Bliss Massage as well, at South Ruislip Library on Tuesday, the 11th of February.
Oh, opposite Sainsbury's.
Opposite Sainsbury's, yes. And there's going to be like myself doing taster sessions, Bliss Massage doing massage, chair massage. There's going to be taster yoga sessions, and group chats about how to manage stress, anxiety, and relaxation. So pop along. It's 10:30 till 12 next Tuesday.
That should be good.
Yeah, and I did the Full Circle Wellbeing event on Saturday in Chesham. That's going to be a quarterly thing. So it's about giving access so people, as you quite rightly said, come in non-threatening. They don't feel under pressure, just to chat and find out more, because we bandy these terms around, and it's even myself, I'm guilty of it. Reflexology, massage, colour mirrors. And as you quite rightly said, you're like, well, what does that mean?
Yeah.
I can get, it's like I'm passionate about doing that. But actually, sometimes I need to take that step back to go, actually, what do people need to know?
Yeah.
And what they need to know is it makes them feel great. It reduces their stress and anxiety, and it lets them be them.
We should probably add that this month is Heart Month as well in Hillingdon Libraries. So lots of events going on around the area, all to do with hearts. I suppose it's because it's Valentine's, isn't it, in February? Is that the link, do you think?
I think so.
It's a bit tenuous, but...
it works. But yeah, no, the important thing is people to talk, to find out more.
So once you've found someone that you like, your practitioner, are there any things you should ask them? Obviously the cost, that's a big one, but... would you say it's good to go once or maybe a few times, or continue the treatment every month? Or obviously it depends what it is, doesn't it?
Yeah, it very much depends.
What are the things they should ask? Side effects, whatever, I suppose.
Yeah, anything. There's no prescription here. It's whatever you want to ask your therapist, you ask. If you have that thought coming into your head, you ask it. So if cost is the primary concern, ask about that. With regards to treatment after that, it'll be dependent on people's financial needs.
Yeah.
And you work together to give a way that gives you both, gives that person what they need. One-off treatments, that's absolutely fine, because that's that person's need at that time. But to get the benefits, the real benefits from the inside out of massage, reflexology, or any therapy, is the continuation, the regularity of it all. So once a month, once every 6 weeks, it's that maintenance top up. If you're coming to see, for example, me for a particular condition to ease something that is chronic for you at that time, then it is better to come for 6 weeks, so that the body adapts and uses those changes on a regular basis. And also you stay in dialogue with your clients, and they talk to you and tell you what's going on. And it's not a prescribed, it's not, you are coming every 6 weeks.
Yeah.
It doesn't have to be like that. And for me, my clients come when they can, when they're able. And I've got clients that come every week. I've got clients that come every 2 weeks. It's whatever works for you. And I will never tell someone you need to do something.
No. And what about like clothing for massage and things? People wouldn't turn up in a suit if you're going to go for a massage. But
well, if you've come straight from work, you will. When I do a massage, depending on the massage, if they're having a full body massage, I give them a towel to wear, and you do good towel management, so no one is exposed at any point, and you keep your underwear on. With reflexology, all they have to do is take their socks off or their tights.
Oh, right.
And I just work on their feet. That's when I'm doing foot reflexology. Facial reflexology.
That's easy.
That's easy.
Unless you're a moped rider.
Well, yeah, then that's a challenge. Actually, it'd be quite good though. But yeah, and ear reflexology as well. That's beautiful. I just trained in that one. Passed that course a couple of weeks ago. Love it.
So the obvious thing, I suppose, obviously, is check that they've got insurance, and as you say, references from different people. They're a member of some registered body. Anything else we should watch out for? If you go into some stranger's house just for a massage, I suppose that could be a bit dodgy. But
there's no one stranger than me, Steve.
if they've met you at a fair, then it's probably she's a nice lady. I'll go and see Michele.
Yes, come see me. No, I run my practice from my home. I have my treatment room in my home, and I welcome my clients into my home.
You're based near Hayes, aren't you? In Hayes.
In Hayes, yes. Yeah. And it's brilliant. It's brilliant. And that suits me and that suits my clients.
And as you say, you can refer people on to, you've got lots of close colleagues that you work with. We've had a few in here recently to talk to, providing different services. Yeah. I've learned a lot about tapping and all other, not odd, but I won't say it's odd. It's just things I didn't know about before. How to relax and how to medicate almost. Ways of being in a meeting and
self-help,
feeling a bit stressed. So tap various parts of your body.
Yeah, the solar plexus on the reflex points of your hand, in the middle of your hand there. If you're feeling a bit tense, just press and circle, and gives you a chance to breathe.
These are good tips, free tips.
Yes.
Nowhere else provides free tips.
If anything I can say or do that helps people, I will freely, gladly help them. But the importance is, remember to breathe, everyone. Remember to breathe. We keep breathing from the top. We should be breathing fully through our body. And when we do that, we enhance our calm.
Yes. Now, I'll just show you a website here, WellnessByMichele.com. And contact details are there. So you're a reflexologist, massage therapist based in Hayes.
Yep.
Contact Michele.
Yes.
Anything else we need to add, do you think?
Just don't be frightened. People can sometimes feel very nervous, very apprehensive about talking to anyone. I'm not there to judge. I'm there to listen, to help, to support, to provide that love and encouragement that that person needs at that time.
Yeah. Well, thank you very much, as usual, for coming in and talking to us, Michele. It's been amazing. I've learnt lots, as usual.
Thank you. I love coming in here, and I look forward to the next time. Can't get rid of me now.
Thank you, and we'll see you soon.
See you soon.